Well, good morning or good afternoon, everybody. Welcome to Cancer Support Community Central Ohio's Lunchtime Learning. We are very excited that Lee is able to join us today. This is a presentation that I've been wanting to be able to have for a little while now. So I'm so glad that Lee has graciously changed her schedule around so she could join us. And Lee, I wanted to give you a thank you gift.
Thank you.
For your time and your expertise.
So nice of you.
Those of you at home, that has some of our Crimson Cup coffee, tea, and one of our coffee mugs. So please enjoy. I'm going to turn this over to Lee.
Okay, thank you very much. I'm Lee Cassioli. I have a private counseling practice in Worthington, and I also do counseling work with Cancer Support Community of Central Ohio. So when Darlene asked me, I'm very excited to share some of my thoughts on how to understand our bodies and how our minds respond to anxiety. You know, for all of us, it's a common experience, but in this presentation, I want to try and share a better understanding of both the blessings and the curses of anxiety. So, one of the things I always say is, there's an advantage to anxiety because I didn't get in trouble as much as a kid because my first thought was, oh, if I do that, my mother will kill me. And so there's where it was a blessing. So I'm going to go through, if anybody has questions along the way, feel free to just stop me and ask, and I'll try and, monitor the time so that we get through all the material. But the first thing I wanted to talk about was the physical symptoms related to anxiety. And then be more specific in regards to cancer and anxiety symptoms. So for everybody kind of has their unique picture of how our body and our mind responds to anxiety. And our body tends to hold the truth of what we're feeling, no matter. And there's actually this book out for PTSD called The Body Keeps Score, and it truly does. So physical symptoms of anxiety can include tension and muscle aches, tightness, and as far as cardiac, chest pain, rapid heart rate, shortness of breath, or having a choking sensation. Also, you can have dizziness, lightheadedness, tingling throughout the body, numbness in your extremities. You can also have a lot of gastrointestinal symptoms. People talk about IBS when they become more anxious. They can also have nausea, upset stomach, stomach pain, diarrhea. Other symptoms are sweating, sleep disturbances, and fatigue. And so as you see, it's really kind of wide range of symptoms that not everybody's going to meet all the symptoms. But some of the medical symptoms related to anxiety can be certain types of cardiac diseases, thyroid conditions, having chronic pain, irritable bowel syndrome, and there are some rare tumors that affect the flight or fight response in the body. And so it's always good to ask your doctor if you're having physical symptoms to decide which it might be. So going to the emotional symptoms of anxiety. With the emotional symptoms, we're looking at just not only feelings, but concentration. Has your concentration decreased? Is it hard to stay focused? Are you reading the same paragraph and not retaining it? Sometimes feeling indecisive and having difficulty making decisions. People oftentimes can feel irritable, tense, on edge, maybe specifically nervousness or restlessness. Some people feel a sense of impending doom, like, the other shoe's going to drop, something bad's going to happen, and they start to worry about that. Also racing thoughts. Some people do social isolation, or they tend to withdraw from others. Some people will try and avoid the stressor. Another symptom might be feeling just internally weak or tired. And some people experience difficulty just being able to control their worrying. It kind of becomes this runaway train where they I'm not going to think about it, and it comes right back. So talking about cancer-specific anxiety, anxiety is a normal reaction to a cancer diagnosis and comes with its own challenges and set of worries to figure out how to navigate. So many people have the fear of recurrence, that they're worried that the cancer might come back. They may not trust their scans. There's also the scanxiety, which Darlene taught me that word. I like it a lot, because people become very scared. And I've even had some people that I've worked with come scared to the point of superstitious, like wearing the same outfit to every single oncology appointment for years, just because it's the kind of their cancer outfit. But the anxiety about scans or procedures, things like that. Sometimes people have anxiety specifically about the treatment or the side effects of treatment. And people tend to worry about physical changes that they experience as a result of cancer and its treatment. And the ones I thought of offhand were the fatigue, the neuropathy, lymphedema, the chemo brain, and potential changes in physical appearance. So the physical changes can be really upsetting and anxiety provoking as well. Sometimes people most people I think feel some uncertainty about the future until they have better understanding of what the plan will be and statistics and all the different things that come with treating cancer. Other things people worry about the future very much, and the impact of cancer on their caregiver and loved ones, family members. And another one that I in my practice talk to people quite a bit about is how they share the diagnosis with other people, because the other person may become highly distressed and you're the one with cancer, but it may feel like you have to help the other person feel better. So let me go to so we'll talk about some of the causes and risk factors for anxiety. One is just plain old genetics. If you have family members who have a history of anxiety, you're going to be more prone to having similar symptoms. So, as I mentioned before, certain health conditions can fuel symptoms of anxiety. One of the ones I know as an example, is people who have mitral valve prolapse. Because of kind of that flapping that occurs, they can experience panic attacks, and it's actually the mitral valve, it's not actually a panic attack, but that's what it feels like. Chronic stress. People who have been under stress for a period of time will have more anxiety and more worry, especially sometimes if they don't have like an end in sight, because sometimes we have those milestones such as the treatment, the first appointments, meeting with the nurse navigator, and sometimes anxiety is about not having enough information or having the chronic stress, whether it's related to work or an ongoing health issue or family problems. People who have experienced trauma are at high risk of anxiety. Trauma tends to affect the brain in ways that create fear, sometimes avoidance, sometimes an emotional shutdown or a dissociative type symptom. And things can trigger feelings of anxiety. Some people who have a history of extreme shyness will have anxiety. People who are perfectionistic, they have unrelenting standards, particularly for themselves. And kind of the standards are those that they wouldn't expect from other people, and that can create more anxiety. Some people just have a personality that's prone to be anxious in thoughts and feelings, and we just learn to work with it. Also caffeine and other stimulants. There's always that person out there that can drink coffee until bedtime, but caffeine tends to stay in our body for 10 to 18 hours after we drink it. And some people it makes jittery. And just thinking about other stimulants, like the medications for ADHD can cause anxiety. And there's just caffeine drinks and all sorts of things that can cause risk factors. Also, use of alcohol or other substances can create that. I will use, for example, like if somebody's prescribed Xanax and they've been taking it like for several days, what they may feel is anxiety and panic, and it's basically the medication wearing off. And so many times people think they need another dose of medication. Same with alcohol. One of the issues with alcohol is people may use it at times to calm down or to sleep. And the problem with it is that oftentimes people wake up like 3 hours after they go to sleep and will feel very anxious. And it's again the alcohol wearing off, but it's also sometimes the sugars in the alcohol, such as wine and things like that, can also cause the symptoms of anxiety. So next thing I really wanted to talk about was our brain. Obviously I'm not a neurologist, so I'm not going into huge detail, but with our brain, anxiety is a messenger. And the messenger is designed to relay potential threats to our safety or our well-being. And we have this part of our brain that's referred to as the amygdala. And the amygdala is where our fear center is located. And the amygdala is a fairly primitive part of our brain, so it doesn't necessarily have language. Our frontal lobe is the part that has stored language. And so all the amygdala does is kind of panic and know that there's something dangerous that they're detecting, but they don't know if it's from the past, if it's a future worry, if it's happening right now. It just sounds an alarm. And so what we want to think about is that the amygdala does not have language. So if you ever notice you're anxious and you can't put things into words, that's probably the amygdala talking. So the ways our brain may respond is impaired decision making, not being able to make decisions, feeling overwhelmed by decisions, having memories of prior anxiety provoking events, having a physical reactivity where sometimes we may know we're anxious because of how we feel in our body, whether it be chest tightness, clenching your jaw, gripping your, making fists, breathing changes. And so we have a physical reactivity, and part of the goal as we go on is talking about how you take that physical reactivity as information and attend to it in a way that it helps you bring down your feelings of anxiety. And partly doing some of the work that we're going to talk about based on our experiences, we can have changes in our neural pathways that increase the likelihood that we have anxiety. And so to go back to, as an example, a memory of a prior anxiety provoking event is sometimes I've had people who wanted to go to like a support group, but they had to go, like if they went to Riverside, they might have to go to OSU because the chemo bay has a certain smell and it triggers their anxiety and worry. And so it's a prior event, but your amygdala is going to say you're in danger, you're in danger. And so we need to learn ways that we have talks with ourselves to do the things that help calm us down. So talking about the ABC method, this is one of the first things you can do. It's pretty simple, but think about an event that might create fear or anxiety for you. An example I came up with is having the fear, some people are afraid of needles or they're afraid of getting in the MRI machine, and that can cause a lot of anxiety. And so you look at what is the activating event, and the activating event might be, I know they're going to, take blood, or I know they're going to give me a shot, or I know I have to get in this tube. And so what you want to think about is what specifically happened. Just put it into words, what happened. Then we look at B. B is how we interpret the event, and it's based on things that we believe. It's based on what we've told ourselves. We all tend to have kind of an internal narrative of events. And so we need to know, what are we telling ourselves about it? And so if we go back to like some type of medical testing, and people will say, well, I'm so afraid of the needles. What if I pass out? What if I, what if I do this? What if I do that? And that will escalate the anxiety, obviously. And so you have to look at how you experience the event and what you're telling yourself about the event. And then C is, what are the consequences or the outcome of the event? And so I think, for example, might be like a medical test needs to be rescheduled. Somebody may be so anxious that drawing blood is more painful. And a lot of times it will create kind of a self-fulfilling prophecy, and then it strengthens that fear, the fear and avoidance in the belief system about the anxiety itself. And so what we want to do is not discount something serious is going on, but what we want to think about is, am I making this better or worse based on what I'm telling myself about it? Like if somebody says, I have a nervous bladder, I'm afraid I won't be able to give a sample, probably you'll have a nervous bladder. And so we just need to look at what's helpful and what's not.
So Lee, when it comes to this anxiety, the activating event would be, I have to have another scan, and my previous scan showed that I had a cancer diagnosis.
Correct.
So the belief or the interpretation is my fear of either either cancers come back, or that there's something related to that. And then the consequences, what's the outcome, is I'm terrified to go in and get another scan for fear of what it's gonna say.
Right. That's exactly it. Yeah. And so you look at, I think you don't know, of course you're anxious. Let's validate that if you're getting a scan, you are going to be anxious. It would be unrealistic to say you weren't, unless you've been cancer-free for like 10 years or something like that. So you want to respect the fear, but help yourself be less distressed, and reminding yourself of, I've had scans and they were better. It doesn't automatically mean that it's going to be worse. So I think if we can just really look at how am I talking to myself about this situation, and what am I noticing physically, the consequences of the event. Somebody might they're so anxious they become nauseous, or their doctor walks in, they're crying. Different things can happen. So we just want to think about that. So next thing is looking at anxiety and when it's a bigger issue needing attention. Because we all have life stressors, we have life transitions, we have different things that can be anxiety provoking. It's when it doesn't reduce or abate after we know the things that we need to know. And so when anxiety is a bigger issue, prior history of an anxiety disorder or diagnosis and treatment of an anxiety disorder is certainly very common, because if you're already prone to anxiety and you have something very stressful occurring, your anxiety is going to increase. Another would be the inability to stop worrying. you try to distract yourself and you notice that your thoughts are preoccupied and it sort of feels like a loop. And a lot of times the worrying will be things like, what if? What if this happens? What if that happens? How's so and so going to respond to it? How's my doctor going to be? Any of those things. And no matter what you do, you can't stop worrying. Another is when you're using the coping skills that normally work for you when you feel anxious, but the symptoms aren't getting better or they're getting worse. That's really important because when I meet with people, one of the questions oftentimes I ask is, well, what have you tried on your own? And somebody might say, well, I tried doing meditation. I tried to up my exercise. I went to a support group, and all of those things are wonderful, but we have to look at when the things that normally will calm you down are no longer working. It's probably time to talk to, like a therapist or physician, somebody who can help you diagnose. A lot of times at the doctor's office, there's an anxiety questionnaire that they give most people if they complain of anxiety. If the anxiety interferes with daily living, such as fear of leaving your house or not being able to do the things that you normally do, avoiding people, not being able to keep up with housework or things that you do on a daily basis, your self-care, if it interferes with those things, that's something that needs attention. If you are starting to have panic attacks, and panic attacks are really uncomfortable. People often end up in the ER with a panic attack because they think they're having a heart attack. And a panic attack kind of comes on as a spell. People may notice that they're short of breath, like they're having difficulty taking a full breath. They may notice that their body gets very warm or very cold. They may shake. They may kind of feel like the room is closing in on them. And panic attacks are, as I said, they're really uncomfortable. They don't kill people, but they're uncomfortable. And if you notice that you're using alcohol or other substances to cope with the anxiety, that can be a warning sign because they can help people initially, but in the long term, they're not as helpful. Okay. So talking to yourself and looking at different skills for managing your anxiety, one of the big things I like to just ask people, and they can ask themselves, is anything bad happening right now? Chances are we hope the answer is no, nothing bad's happening right now. And so it's checking in with yourself and asking, I'm feeling anxious. I feel like the impending doom, but is anything bad happening? So that's really important to, get your perspective. Another one is your self-care. Taking extra good care of yourself when you're experiencing anxiety, like making sure that you're prioritizing your sleep, you're getting good nutrition, you're limiting caffeine and alcohol, you're exercising if that's something that's available to you. You might be meditating, but you can try all sorts of different things in terms of your self-care to see what helps and what is kind of neutral. Because usually if you're working on self-care, it's not going to make anything worse. And the other one I think is, limiting your media, especially when you're anxious and you don't, because people tend to start doing the searching because they want answers and they want to understand more. And there's really nothing wrong with that. But I think it's important to keep to reputable sites, to limit your searches as much as possible, and that you're using reliable sources. Another thing, like especially for people who are currently having some anxiety about political changes, it's important for them to turn off their notifications so they're not stressing themselves out with everything that comes to them, because there's so much coming to them. And think about, well, I'll look at my news feed in the morning or the evening or whenever I might do it. But I think we have, it's again, blessing and curse, too much access to information. And sometimes that's helpful, and many times it just makes us feel worse. Seeking support, whether that be friends, support groups, therapy, whatever it might be, support is incredibly important. And we need to kind of normalize when you're going through something like a cancer diagnosis or caregiving, you're going to be worried and you're going to be anxious. So, of course, you need more support. And sometimes it's more helpful to, when you're talking to people about support, about what specifically they could do to help you. So I said therapy, but utilizing therapy and support groups as much as possible. We're lucky to live in a larger city where we have many options. Some people find journaling really helpful. It depends on if that's, some people are writers and they enjoy that a lot. What I suggest to people, if you're really having a hard time getting the words out, is just write down the first 3 words to come to mind and call that your journal, and that's fine. But, recognizing what you're holding in, and then learning the skills to calm your central nervous system. And we'll talk more in detail about that, because we want to be able to calm our nervous system down so it can respond to like the skills and the interventions we're talking about today. Another thing that some people find really helpful is they're going to worry. So they end up setting up a time to worry. And they kind of, so it's because part of worry is don't forget, don't forget, don't forget, don't forget. So if we say, okay, well, I'm at work right now, or I'm having, lunch with my friend or whatever, this is not my worry time. My worry time's tonight at 7:30. And you limit the time. You don't want to spend hours, worrying, maybe 15 to 30 minutes max. But sometimes it's very helpful to set aside worry. So one of my personal favorite tools that I tend to use all the time is something called the window of tolerance. And the window of tolerance is really pretty simple. Like our actual window of tolerance would sort of be like what we would call our equilibrium. And that's where we feel balanced, we feel calm, we feel in control, we're relaxed, we're functioning well, and we're managing our challenges. And that's obviously the goal we want. So when we look at the hyperarousal, which is when we feel stirred up, you might feel anxious, angry, it may feel out of control, you may feel some panicking feelings, it may be hard to sit still, and it can feel like there's a whole lot of bundled energy inside. The other is what's referred to as the hypoarousal, and that's more the shutdown side where we're seeing depression. People are kind of emotionally numb. They're isolating. They're exhausted. They may go into freeze mode. I'm gonna see if I can switch to another. I found this thing. It's no, you can't see it. Okay. Let me go down because I just want to talk a little bit about what this author said. Her name's Laura Kerr, and I liked her arousal zones. Like the hyperarousal is the flight or fight, and so you get the tension, emotional reactivity. You might be defensive. Your thoughts are racing. You may have images that are upsetting, feel overwhelmed or unsafe. Your thoughts may be kind of obsessive, and they just kind of go in this circle. You can feel like you're on guard. You can feel like, out of control, like you're going to do something impulsive, or you may feel angry. And when you look at hyperarousal, you're looking at hypoarousal, sorry. Just shut down, not feeling things, not having energy, moving less, not feeling present, difficulty thinking, emotions may feel numb or may feel disconnected. You may have people sometimes feel ashamed, they feel flat, almost like they don't have feelings. And so we want to get into our window of tolerance, which is where you're able to think, you're able to feel, you can experience empathy for yourself, you can tolerate the feelings, you can be present in the moment, the right here, right now, feeling safe, being able to be open and curious, and your reactions are appropriate to the situation. So that's kind of where our goal is with the window of tolerance. And so I think one of the things I do a lot with people is talk about, are you in your window of tolerance? What can we do to get you back into your window of tolerance? And the more that you recognize when you're there, the more you can look at, this helps me or that helps me when I'm feeling this way. So let me Okay, so one of the skills that you can use when you're outside of your window of tolerance is what's referred to as a grounding exercise. And grounding is a way of taking kind of the runaway train of worry and bringing yourself into the present. And for example, this is something that you could do in a doctor's office or a hospital or anywhere else where you might feel anxious or tense or feel like you're kind of shutting down. And it's that way of getting our frontal lobe of our brain back online so we have language and we have the ability to express what we're experiencing. So the grounding is actually really simple. You're using your 5 senses. And so think about naming 5 things you can see. And that may be example, you're in the doctor's office and it might be, you know, I'm looking in here and I'm like pamphlets, bags, books, desks, counter, and you would just go through that wherever you might be. You can think about 4 things that you can touch and name those things and actually physically touch them to help kind of create that connection being in the present. 3 things you can hear. And sometimes, you know, be things like the air conditioning, or there might be, if it's a doctor's office, maybe chatter with the office staff or somebody's talking in the waiting room. And so you think about the things you can hear. And then 2 things you can smell. And then 1 thing that you can taste. And it's okay to have something with you that helps, you know, like a scent that helps you feel calm, or a piece of gum or something like that, you know, that helps bring you present. So we're gonna go to the next one. Okay. The next skill, which I know you're probably waiting for, is the breath work. And there's different types of breathing, and the breathing sends signals to our into our parasympathetic nervous system, and it's designed to help promote calming. And breathing exercises tend to calm the nervous system when done over time. And there's many types of breathing exercises you can use depending on what resonates with you. I tend to, you know, like people to pick what they like rather than what I think might be good. And so there could be the deep breathing. You'll hear sometimes people say deep belly breathing. And those exercises, like if they're done for 20 minutes, and I know that's not always available to people, but it will bring a sense of calmness into the nervous system. Another one, if you're feeling highly anxious, is to use what's called 4-7 breathing. And what that is you take a breath in for 4 counts and you breathe out for 7 counts. The reason is the longer that you exhale, the quicker you can bring on a relaxation response within your body. Also recommend the pursed lip breathing. This comes from people who have lung diseases, and we used to use it with people with COPD one place I worked, and it's basically forming your lips like you would around a straw or something like that, and just taking slow breaths in and out, but not taxing your lungs, and calming down enough that you eventually can take deeper breaths. But I think the pursed lip breathing, especially for panic attacks, can be really, really helpful. Let me see. And so, but it allows you to get the same benefit. And then just keep breathing in and out. Another is meditation. There's a lot of great meditations. Like, I know we have a group here for meditation, but there's also like a lot of good resources on YouTube that you can use. I'm thinking John Kabat-Zinn's a good one. Elisha Goldstein is a good one. And they will walk you through it and help you manage it. And I think John Kabat-Zinn, a lot of his information is related to healthcare and health conditions. Some people do better with walking meditation. And so there's different paths, places where they can do that. And people sometimes who are perhaps runners or cyclists, that the revolutions or the heel strikes, that can become kind of a meditative response. And for many people, there's different ways that they find that help, and they feel meditative in that environment. And that, of course, can be with prayer. It can be with gardening or fishing or anything that fully engages them and helps feel calm. Yoga, which I know we offer classes here on yoga. Yoga is really helpful because it's also breath with movement. And so if you're feeling anxious and fidgety, it may feel difficult to do breathing, but yoga movements will help. And the same is true for Tai Chi and Qigong because it's slow. The movements are slow. They're very intentional. And they tend to help people both with strength and with anxiety. Another one that I have people do intermittently if they would like, is there's what's called the mammalian diving reflex. And for some people that might be, plunging your face into a bowl of ice water for about 30 seconds. The other option is to just grab, like most of us have those blue ice packs, or you had, some kind of food delivered and you've got, I think ours are usually white, but just put it on your chest for 30 minutes. It kind of creates a distraction, and the cold calms the nervous system. Another one that, if you don't have that available, is to use something that you can taste, like like a hot sauce or a sour. There's these candies that kids seem to like called warheads, and they're just intensely terrible. But the point is, you don't want them because they taste good. You want them to disrupt the anxiety cycle and bring you back to the present. So those are this is, I think, an important skill when you're really stressed out and you're trying to figure out how am I going to calm myself down, is try ice. Okay, another skill that I like to use is scaling. All of you probably been to the hospital, so you know what the pain scale is at the hospital. This makes it easier because this is your anxiety scale. And so you want to look on a scale of 1 to 10 and start to recognize, what your body's doing when you feel certain levels of anxiety. You also want to recognize thoughts and feelings, how you're breathing, things like that. And so what I tell people is, if you're like a 7 or above, everybody's like, take deep breaths. Well, that may not be available to you because you're too anxious and too agitated. And so using your large muscle groups in some way, whether it's, walking or rage cleaning or just moving your arms up and down can help burn off some of that anxious energy. And then when you get below a 7, most people can do the breath work to calm their nervous system, but a lot of times you really have to use the large muscle groups and movement at higher levels. The other way that you go with this is you can rate your anxiety on a scale of 1 to 10. And let's just say in this instance, you're at a 6.5. So your goal is, what can I do to drop this by a half a point or bring myself to a 6? And it doesn't really matter what it is. It's just more of doing something. So it can be a distraction. It can be, it can be doing a hobby. It could be calling somebody. It can be just anything that kind of disrupts the anxiety and the worry. And you may do it and go, but I'm still anxious. And yeah, that's to be expected. You just keep working at it until your anxiety's reached a point where you feel like you're back in control and you can handle it. So that's that. And then let's go to our noticing your skills, noticing your thoughts and words. So when we look at our self-talk, that's our internal dialogue, which I talked about a little bit more before. And it's an internal dialogue that can either reduce your anxiety or fuel your anxiety, just like when we were talking about the scans or fears. Notice what you're telling yourself. And the goal is really to not push the anxiety away. It's more to respect it and kind of accommodate it without getting caught up in it. Sometimes I've referred to anxiety as sort of like that relative that comes to dinner that annoys everybody, but you're not going to exclude them because they're part of your family. And you just think about, well, the anxiety's here. What can I, how can I help it? And so the big questions that you can ask yourself when you say, what are you telling yourself? Is what I'm telling myself, is it helpful? Is it kind? And is it effective for the situation that I'm in? And if the answers are no, you want to kind of reframe what you're telling yourself. And some of the ways to challenge negative or unhelpful thoughts or words is asking yourself for the validity. What's the evidence? Is there evidence for what you're telling yourself? What's the evidence for? What's the evidence against? And not going back in the cycle, reminding yourself, really, is there any evidence of this right now? Just like the question, is anything bad happening right now? Another thing might be, what would I say to somebody else who was in my situation? And chances are we would give them more grace than we give ourselves. So thinking about, well, what would I tell a friend or what would I tell a peer? That can be really helpful. Another thing that I like to use is just statements starting with even though. And so it's even though, so we're acknowledging the anxiety and the worry. So even though I'm worried about my upcoming scans or other event, I'm confident in my ability to navigate the challenges, or I have been through this experience before. And the other thing you can look at is, what does the blue one say? I can't read it.
Of course.
Of course. Thank you. And so, of course, statements. What I like about of course statements is you're acknowledging how you feel. Of course, I feel anxious going to the doctor. Of course, I feel anxious having these scans. Who wouldn't feel anxious in that situation? It's just we're trying to avoid the over-the-top anxiety. And just trying to reframe your thoughts in a way that helps you get back into that window of tolerance. So let's talk more skills. I think monitoring is really important with effectively managing your anxiety. And monitoring would include checking in with your mood. What's my mood today? How am I feeling? What's my energy level? I hear people talk about the spoons theory. How many spoons do you have to do a certain thing? You know, how many spoons do I have today? What's my breathing like? Is my breathing shallow? Am I not taking deep enough breaths? Is it kind of ragged? We do different things when we're anxious, and people oftentimes hold their breath when they feel anxious. So the more that you can recognize, oh, I'm really holding my breath, I need to calm that down. Noticing your ability to focus and stay on task, and asking yourself, how does my body feel today? Where are you feeling tension? Because all of us feel tension in our body in different ways. And so if you tend to carry it, in your shoulders, notice if your shoulders are heavy, or notice if your jaw is really, really tight. And just, how does my body feel today? Is there anything I can do to just loosen up that tightness a little bit? Is there anything I could do to just kind of stretch? Would something warm or cold make my body feel better? And just asking yourself those questions and helping you know what's the most effective thing for you. And so also knowing your triggers, because your triggers, we need to respect those because they send you a message of something that you found distressing. And so the trigger of being in a chemo bay, or being at the doctor's office, or being getting blood work, or whatever it might be, thinking about what the triggers are, and all you need to do is just kind of say to yourself, well, I got triggered by this, this, and this. I use the example, I was in a really bad car accident like 30 some years ago. And every time I go by that intersection, I notice that I will start clamping the steering wheel as hard as I can. And so my body remembers that I got hit at 161 and 71, even though I've been hit once in 30 years in that location. And so it's not always rational, it's just what ifs. So the important thing is about planning ahead, knowing, I may feel anxious in this situation, so what will help me feel less anxious? It also allows you to prioritize the things that are the most important to you. And I think, accommodating what your needs might be. Sometimes people are anxious or uncomfortable about saying, I'm going to need a chair I can't stand for X period of time, or they may need a water beside them, or they may need a fan on them, and things like that. And I think helping people understand like what your care and feeding might be in a given situation will help you feel more comfortable, and it accommodates your needs. So monitoring is incredibly important. Then I'm going to throw out some other skills. Finding all sorts of ways to anchor yourself in the present. And we talked about some of the skills that you can use to anchor yourself. So just, I've had people, for example, that might wear a piece of jewelry, and it's a reminder, like a bracelet or something, and they're reminding themselves, am I in the present? You can be in different locations. Like sometimes, like in a medical setting, there's usually a clock. And every time you see a clock, taking a breath, reminding yourself, stay in the present, relax, and just doing those exercises. Using distractions. A distraction might be calling a friend. It might be if you're a knitter, being able to do a craft, watching a favorite clip, reading a book you enjoy, but distracting yourself from it to buy you some time to bring the level of anxiety down. The next is engagement, and that's getting involved with things that might have to do with health, they might not, but engagement, whether it's volunteering or church or different environments where you are meeting up with other people, can be really helpful. It helps you feel less isolated. Sometimes you're going to find people have similar experiences or feelings. Using creativity, I think, is a really great one. because for example, doing art, you don't have to be an artist. It's just getting what's inside out onto a piece of paper. Creativity might be people who play an instrument or garden or decorate or do woodwork and things like that. And so using your creativity, and that kind of just leads into making sure that you're engaged in hobbies, because things can feel really heavy, but it's really important to have the enjoyment and the distraction of a hobby. And I think one of the really important things is people try to compare. It's, how we kind of normalize things. And my experience with working with people with cancer is it's really hard to compare from one situation to the next and one treatment to the next because it's so specialized. So trying not to compare what may not be comparable. And the last one is self-soothing. And self-soothing are those things that you find comforting. And that may be like scents, it may be, a blanket or whatever is comforting to you. So making sure you're doing things that help you feel soothed and calm, cared about. Those things are all really important. So keeping grounded as possible and getting support. That's what we want to think about. Is everybody who's on this call knows the Cancer Support Community of Central Ohio offers a lot of great programs and supports based on what your needs are. Support groups here or through different hospital systems, Facebook groups, whatever it might be. Oftentimes medical providers have certain supports in place in hospitals, and having that nurse navigator who can tell you where the resources are. And one of the things, because I used to work for a company where we did this a lot, is care coordination. American healthcare is pretty sadly not well care coordinated. And so it's really important to know some things that you didn't necessarily know. Like for those of you, your insurance benefits may include what's called either a care coordinator or a nurse care manager. And these people are dedicated and have extensive knowledge on your health plan and the programs that you might be eligible for based on your diagnosis. And so one of the criteria that used to exist was having one or more chronic health conditions. Usually means as long as your employer, your plan purchased it, is having a care manager to help you navigate those types of things. And they can help, the care manager can help you understand your benefits. They can sometimes, if needed, communicate with your medical providers or to help advocate for certain types of treatments. And sometimes they'll set up phone calls, once or twice a month. And it's your opportunity to ask some questions and to ask them about any benefits that you might be eligible for. And so, some examples I've seen have been things like nutrition support, exercise, educational programs like smoking cessation. The program I worked for, we did counseling and coaching for people. We had, I think, 6 different medical conditions. And that was a benefit where that they got for free. I think it was almost 12 counseling sessions, 11 coaching sessions. So it's really helpful to know to have a care coordinator. So that's where I'm stopping. What questions do people have?
You're welcome to use the chat, or you're welcome to unmute if you're muted. If you have a question for Lee.
One thing,
Yes.
Absolutely, who's talking?
one thing that I find is things feed into each other
Mhm.
and I get sick like.
Yeah,
I might not have a little trouble falling asleep and then I get anxious about falling asleep.
right,
I
exactly.
really can't fall asleep. And then the next day I'm tired, which makes
Yes.
it harder to get through.
And then you
daily
start thinking
tasks.
about how tired you're gonna be.
Yeah, and then I don't want to see a friend because
Yeah.
I just want to go to sleep, but.
Right, because I'm so tired.
I break that cycle.
Yeah, and that's a good example with anxiety. I used to have a book that I used with anxious kids, and it talked about, and it's this time of year, you get a tomato plant because you want a few tomatoes this summer. And then you end up with like bushels of tomatoes and you're giving them away to everybody. And anxiety is a lot like that. It'll latch on to the next thing. Kind of it sort of has these tentacles and it'll just latch on. And so what we have to kind of look at is you've had a sleepless night before. And it wasn't the end of the world. It wasn't that comfortable, but and so you kind of have to look at, well, just because I'm not sleeping tonight doesn't necessarily mean I'm going to be tired tomorrow. I might be more tired, but it doesn't mean I can't meet up with my friend. And so I think, recognizing that you want to interrupt once you start to notice, and that's why I call it the runaway train, because that you just get one anxiety provoking thought after another, and you get more and more upset, more and more anxious, and we tend to know this isn't helping, but we can't stop it. And so the sooner you stop it, and that's where I'm talking about what can you do to prevent this when you first notice it, because it's a whole lot easier to manage. So does that answer your question? Okay, if you have more, feel free. So I'll try and be more specific.
I have a question. What is a nurse navigator?
A nurse navigator is usually either at the hospital clinic or a doctor's office, and a nurse, Darlene could probably answer this better, but a nurse navigator helps people know what they're going to be doing in treatment, provides them with referrals and different resources that they can utilize in their community.
Yeah, absolutely. That's a good way to answer that.
Okay.
And the best way, most as Lee was saying, most doctor's office and cancer centers have nurse navigators, or they also, I believe at Ohio State University, they're called patient care resource manager. But then there's also oncology social workers who do a lot of navigation. So if you don't have a navigator, I would, next time you have an appointment, or even in my chart, ask if we can connect it. And some places, some of the systems have navigators that are specialized. So there's a lung cancer navigator, there's a breast cancer navigator. So if you don't have someone like that, definitely ask to get one, because almost all of the cancer centers and facilities, medical facilities have somebody like that on staff.
Okay, thank you.
Other questions? All right, well, thank you.
Well, thank you, Lee, very much. We greatly appreciate you spending your time. Lee does have a very robust counseling roster, and so being able to schedule her clients around us is greatly appreciative. So thank you so very much, Lee. For those of you at home, I will be sending a SurveyMonkey evaluation because we're able to provide our programming at no cost. We do have to give outcomes and reports back to our funders. So please complete that. And thank you for joining us today. And we look forward to seeing you at future programs.
Thank you.
Thank you.
Thank you.